Hi everyone, we have a special guest today. We have Shannon, one of my clients. She's in her last month of pregnancy and we're excited to have her because she's got a bunch of things that a lot of pregnant women suffer from, whether it's swollen legs or tight muscles, that really tight feeling of the abdomen, as well as difficulty breathing, and not to mention acid reflux. My question to you is, why suffer? Believe it or not, that physical therapists that are trained in working with pregnant women can help in improving these functional things and reducing swelling and all that fun stuff. Today we're gonna actually work on the difficulty breathing part. So we're gonna work on that with Shannon and see the things that we do here at Rehab and Revive, but that way you guys can see that these things can be improved and improved rather quickly. So before we get started, we have some before and we're gonna do some after breathing. So we're gonna cut to that. So as you can see, there's one side that's moving better than the other. The right side is a little bit more collapsed, moving, doesn't have as much excursion. So we're gonna see if we can make that improvement over our time. Left side seems to be okay. And of course, we just want her to have better breathing and less discomfort throughout this. All right, Shannon, so what we're gonna do is we're gonna start you off by actually just improving your hip range. So go ahead and lie on your back. So why is it important for hip range to improve? Believe it or not, we have the diaphragm, which is up here, right? And then you have the pelvic floor right here. So I think these are the keys that when you're breathing, they work together. So obviously baby is down here and pressing on that pelvic floor and gravity and all that is coming along, but go ahead and actually breathe right now, Shannon, if you can. And you can see right as well, this is more excursion again, and just like when she was sitting. So right there. So let's see if it makes changes. So why work on the pelvis or the pelvic floor? Very important to see your pelvic floor specialist, as well as anyone that can help improve orthopedically. So for Shannon here, are you comfortable? Okay. You can see that she doesn't even get past neutral all that amount. If this is neutral here, boom, she should get at least another 30 degrees. So over here, oh, definitely not neutral. She's like slightly about 2 to 3 degrees outside. So the right side, we want to make some improvement. So what we want to do is we're going to improve this hip. So there's a couple techniques here. I do a little bit of a lift and really just try to lift some of the oblique muscles. A lot of the oblique muscles on pregnant women are being stretched. A lot of you who have that splitting, that diastasis recti, believe it or not, the oblique muscles have a lot of play in here. And in a future video, we'll probably show some taping methods as well. So stay tuned for those. But right now, I'm just kind of helping her. Let me know if anything is uncomfortable. It's okay, I know we're filming and everything, but you are the boss here. Okay, good. And the baby's the boss too. Good. All right, good. All right, so let's see here. Do you see this all of a sudden, everyone? I just made that quick improvement. Now, of course, exercises are gonna make it stay. We'll maybe have some time, but right there. Go ahead and take a deep breath now. Does that feel easier on your right side? Yeah, so if you want to take a look, everyone, I just did this right here on her right side. Now you can see it's expanding and belly's moving. Nice. Think of it like a balloon, right? A balloon should three-dimensionally expand, and that's our diaphragm system. We want that to definitely improve. So let's go back to this side. Oh, you know what? I just worked on the right side, but look at that. I didn't even, that left side is already improved. So we can do some re-education techniques just to do that. The bulk of what we're doing today is going to be her rib cage. I'll explain that a little bit. Go ahead and squeeze your butt if you don't mind. Hold. Don't let me move. Don't let me move you. Good. And good. I want to re-educate. These are great exercises. We have exercises called the hip holds. We can link those. In the descriptions box below. Hip holds are great for women who are pregnant. Great. Good. And here as well. So this is just some strong, and this side's weaker. Can you tell? Yeah, she can tell that this is, that side's much stronger. So you can see that the dysfunctional side, I just went straight to it. Now, in an integrative system that we perform here, at Rehab and Revive, we're treating the whole body. So that's the cool thing, is that you want someone that's always targeting the whole person. And of course, based on the deficits. Good. All right, take a deep breath now. Let's see. Just by improving that. Oh, wow, look at that. Do you guys see that? That is really cool. Like, this is no CGI here. Right over here, you can tell that, wow, I just worked her hip. What do you, Dr. Lin, working on a hip, and then that's just mind-blowing, right? Like, that's crazy. This is awesome. This is great. You can tell. It's really cool, right? And so I'm going to now prop her legs up, and then we're going to get to the nerves that go to the diaphragm. So we're going to do that next. And okay, so very important nerves for a lot of you PT students out there. There is a nerve called the phrenic nerve. So it's C3, 4, 5. They keep you alive. That's how I remember for my board exam. So they go and attach here. So just by, and generally it's right around here. So just take a deep breath again, Shannon. Good. So let's see if we can make that more symmetrical, right? Still, this is much faster than this side for all of you. And I'm just going to do some techniques that we do here just to really improve her a little bit. So we perform a neuromechanical type of practice. We work on nerves, we work on mechanics, and that's like the whole body, the whole type of picture that we're trying to paint. So we do that with not just people who are pregnant, but athletes and people in chronic pain. It really responds super well. So good. Not trying to pop anything, so I can tell you, if you guys look real close, you want to zoom in right here, right by this necklace, this doesn't move that well compared to here. Look at that. And the nerve, if you guys don't know how to manipulate nerves, don't tinker with it. Find us, find a specialist. But that is such an important thing. Is that okay, Shannon? Yeah, it could be uncomfortable and could make someone feel dizzy if you're poking too hard. So let's make that a little bit better. I'm gonna put pressure, is that okay right here? So the nerve is gonna cut through here for all of you. Diaphragm, think of it like a dome or a little umbrella. And right here, so I'm just gonna do a couple of my techniques here. You guys can just, look at this and you can see just, if I can get this nerve to move, I'm just gonna do some light kind of stroke there, then I think we'll have some more room for her and the baby, and both will be happy. So, how cool is that? Look at that, guys. Now, I have one more segment. I could feel just a little bit. It's not moving that well here compared to here. You guys can tell. All right, so let's make that happen here. So there is a little block here. For some of you who don't know, this is called a Lin defect. Shannon, what I'm gonna have you do is you're gonna, with your right hand, point towards that light there, good, and stretch it for me. And then you're gonna look up, keep your eyes open. This is a technique not to be performed by anybody unless they've been trained by me. Look up, Lin defect, you can look that up. We have a couple videos about that, but something's stuck there. And that's when there's like it's a facet joint problem for some of you who are really interested. It's a facet joint problem that gets not just out of place, misaligned, but it's actually almost like dislocated. Sometimes people who pop their neck or have very lax ligaments, it can just change. Good, relax. How does that feel? Okay, take a deep breath now. Look at that. Do you guys see that? That is, Drake is doing a great job behind the camera. He's gonna show that this is now symmetrical. It is moving together. Imagine a pinched nerve right here, improving that. That is so different. Yeah. Now I'm just gonna work the nerve just a little bit because I still feel some tension. Those of you who are really interested, underneath my fingertips, there is still tension here. So I'm gonna really get that. And good. And then I think if we can get this to move, you're gonna see a big change, like I'm hoping right here. Right now she's not breathing in here, right? So let's see if we can make things. I like Babe Ruth, I want to call my shot, hit my home run, Do you know who Babe Ruth is? Oh, okay. It's not just a candy bar. So good. Good. Okay, look at that. I called my shot. I do this so much that, yeah, look at that. There's expansion right here. And that is really cool. I haven't even touched her ribs yet. I haven't had to show her a weird exercise or anything just yet. But that is good. We're setting up the play, you know, we're setting up it's like a chessboard, right? We're setting up this power play to make some moves now. Now we're gonna get her ribs in the right place and she's gonna feel great. I already know that. How do you feel so far? Are you okay to change positions? I'm gonna help you a little bit. Okay, so we're just gonna take a little second to change positions and we're gonna cut from here. All right, so right now we have Shannon in this position. This is a little inspiration from my mentor, Diane Lee, and she has done a lot of research on rib cage and thorax and pelvis, but I've adapted a little bit to make things move a little quicker. But definitely check out her integrative systems model. Those of you who are professionals and wanting to learn more, she also teaches, I think, massage therapists as well. So yeah, this is great. So right here, if you kind of take a look, we've already improved the neck, we've improved the hip. So now we've kind of, you know, I always tell people this is like the scaffolding. We're always trying to build that support system. You know, when a bridge collapses, you don't just put the new piece back on. You have to bring the scaffolding all the way through, and then you put the new piece in, and then you scaffold and create the support system. So take a deep breath, Shannon. So you can see still there's a little lag. If you guys kind of want to look here, you can use even these wrinkles on her shirt. You know, this side still moving great, and this side not so much, right? So I like to think of the ribs like Jenga blocks or a stack of plates. And if I run my fingers right across here, is that okay, by the way? Right here, boom, that is protruding, and these are, do you feel the difference, Shannon? These kind of poke out. So I've got a bunch of techniques here. I'm gonna help kind of restructure that. So I'm gonna have you bend to the left, good, and we're just gonna do a little bit of pressing right here, and I'm gonna have you do a slight one-arm push-up left here, good, right there, good, and breathe. So what I'm trying to do here is I'm trying to slot these plates, or these rings, as my mentor Diane would talk about, rings, as well as, or you know what? I like the analogy. I used to get the analogy of Pringles chips. They should really just stack up on top of each other. I think that's a better image for a lot of you. So, good. There we go. And drop down, please. And now I'm gonna have you bend this way. Turn your head to the right. Good. Good. So this is a great technique. Maybe we'll call this the Shannon technique. What do you think? Since you're brave enough to be on camera. Turn head left. Good. All right, working out the Shannon technique here. I like that. Has a good name. She's laughing, so it's good. A little nervous to be on camera, you know, especially vulnerable. So make sure those comments are nice out there. It takes a lot of bravery to show yourself, especially being pregnant, and so there we go. Good. Do a one-arm push-up left. Good. There we go. Good. This is great. You're doing okay, by the way? If you feel dizzy, lightheaded, or anything, please let me know. Good. And let's go this way. So we're gonna straighten, hopefully the goal really is to straighten up this whole column. And we really want that to be nice and easy. Good, back down. Good. And do a right twist here. I'm just basically going from all the way from the bottom up. Obviously I would, I'm gonna be cautious around here in the chest and breast tissue area. But for men, I definitely also can work up here a little bit easier. Drop down, good. Okay, one arm push up left. Good. There we go. Now it's moving nicely. So think of it out here, right? If it's like all unstable here, imagine everything up here is gonna be also unstable. So the things that we worked on, like the nerves in the neck, they get pinched, they get out of place. And then what has to happen after that is then, you know, your body's left guarded. And guess what? All the muscles that are need for breathing that the neck help with, go ahead and take a deep breath now. Look at that, right? That's instant change. Once again, there's no CGI here, right? I'm too poor for that. No one's donating to our YouTube channel. Good. All right, turn your head left. Left, left, other left. Good. There we go. Good. Good. All right. So right here, is that okay, by the way? I'm gonna, there's like a sensitive area here. It's called rib 2. If you guys kind of, well, you guys can't see, but I'm feeling like a little thorn here. It's tender, right? Yeah. So I'm gonna try to be quick, and then we're gonna recheck it, and we should be pretty much done after that. Good. And then, believe it or not, I believe the collarbone system is actually, when you're kind of in a push-up position like this, acts like a rib too, or almost even shaped like one. Go ahead and take a deep breath. Good. So you can see now it's more even, right? This is great. Everyone's seeing this. It's moving up, out, out. Now I just want to do a couple things here. I'm gonna press here. It's gonna be a little sensitive, Shannon. Good. Good. And here, and good. So now I'm gonna leave her where she's at. Okay. And go ahead and take a deep breath. Nice. How's that feel? Good? Yeah. Okay, so don't let me move you. We're gonna re-educate this because that's what it is, right? We can put things in the right place. A lot of you guys who go to the chiropractor or get a massage, a lot of the times you feel good right after, but the re-education is the glue. That's gonna be the key to improving. Good. Hold, hold, hold. Nice job. Nice job. And then I like to add, you know, stabilizing the neck a little bit. Is okay here? Hold. Don't let me move you. Good and good. Hold. Nice. And hold. Good. And hold. Nice. Okay, so we're gonna transition to Shannon sitting up and we're gonna see how she feels. But overall, great sessions, able to call those shots. All right, go for it. Good. Have a seat right here. All right, so we're back and we just did the treatment. Of course, you know, it doesn't happen all in one session. I've been working with Shannon a little bit on her body, and you know, things get just twisted all the time because of just uncomfortableness. But like I said, find yourself a specialist. You guys can also find us here at Rehab and Revive as well. And we can help figure things out to make your pregnancy a little bit smoother. But just take a look here, everyone, especially here. I think that's the big thing, is that before and after, you're seeing the changes on the spot. And that's great. What do you notice? Yeah, easier to breathe. So, like I said, we're super grateful. We're gonna tune back out to our outro. I appreciate you guys, and be nice on the comments boxes, because we have a nice pregnant woman who has been able to and willing to film with us today.